9 worst foods for arthritis you should avoid. Arthritis, a term that paints a picture of pain and discomfort, is a formidable adversary for many. This condition, encompassing over 100 different types, primarily affects the joints, leading to swelling, stiffness, and often debilitating pain. In the United States alone, over 50 million adults and 300,000 children suffer from some form of this joint disorder. This makes arthritis one of the most widespread health issues, cutting across age and demographic lines. The impact of arthritis on health and quality of life may be profound. It not only limits physical abilities, but also has psychological and emotional ramifications, contributing to increased rates of depression and anxiety among sufferers. As the search for relief continues, understanding the role of diet in exacerbating or alleviating arthritis symptoms becomes increasingly important. In today's video, we have explained 9 foods that are considered the worst offenders for those battling arthritis. One note to remember is that you should always talk to your doctor or a registered dietitian before making any major changes to your diet. Let's get started. 1. Sugar and refined carbs. These two are a few of the most common elements in our everyday diet, but many people will be surprised to know that they have been linked to the development and exacerbation of arthritis. Sugar and refined carbs are known to trigger an inflammatory response in the body. This is particularly significant in the context of arthritis, which is fundamentally an inflammatory disease. Consuming these foods leads to a spike in blood sugar levels, which prompts the release of inflammatory messengers called cytokines. Chronic inflammation may lead to the degradation of cartilage in the joints, increasing joint pain and reducing mobility. Moreover, excessive sugar consumption may lead to dysregulation of the immune system. It alters the balance of gut bacteria and may potentially trigger autoimmune responses, where the body mistakenly attacks its own cells, including joint tissues. This autoimmune response may contribute to the development of rheumatoid arthritis. A study spanning over 3.38 million person-years found a significant link between sugar-sweetened soda consumption and rheumatoid arthritis in women. Women who drank more than 1 serving of sugar-sweetened soda daily had a 63% increased risk of developing seropositive rheumatoid arthritis compared to those who rarely or never consumed such drinks. This risk was even higher for those over 55. 2. Red meat. It has always been a popular yet controversial food. Red meat, especially when cooked at high temperatures, contains components like saturated fat, polycyclic aromatic hydrocarbons, and preservatives. These substances may trigger inflammation in the body, which you already know is the primary reason for arthritis. Saturated fats, for instance, are known to activate pathways that lead to the production of pro-inflammatory cytokines. Red meat is high in iron, which, in excess, may catalyze the production of reactive oxygen species, leading to oxidative stress and inflammation. Also, red meat during cooking may contribute to the production of advanced glycation end products, which further promote arthritis. A large-scale cross-sectional study involving around 700 participants examined their red meat consumption and chances of arthritis. It was found that those who consumed more than 100 grams of red meat per day had an earlier onset age of rheumatoid arthritis and a higher BMI compared to those who ate less. Notably, the age at disease onset for high-intake patients was about 6 years earlier than for low-intake patients, particularly evident in smokers and overweight individuals. 3. Fried foods. In this fast-paced world, people are mainly eating fried foods, which are easily available on the market and simple to prepare in their homes. However, when foods are fried, especially at high temperatures, they induce the production of advanced glycation end products. These are formed when proteins bind to glucose molecules. The body's immune system attempts to break down these products, leading to the release of inflammatory cytokines in large quantities. Thus, consuming fried foods promotes inflammation and enhances the symptoms of rheumatoid arthritis. As you may already know, fried foods are high in calories, but low in nutritional value, making them a leading cause of obesity. Being overweight puts additional pressure on joints, exacerbating arthritis symptoms. The increased pressure may result in the grinding of cartilage and increased inflammation. It becomes extremely detrimental if people already have weakened bones. In addition to that, many fried foods are high in trans fats, which occur when unsaturated fats are hydrogenated. This type of fat is known to increase inflammation throughout the body. While they don't directly cause arthritis, they may contribute to its development and aggravate existing arthritis symptoms. In light of this, it is of the utmost importance for individuals who suffer from arthritis to steer clear of foods that are high in calories and foods that are cooked at a high temperature. Some examples of foods that should be monitored include those that contain high levels of purine content and beef consumption. It is important to keep in mind that the primary components of foods that contribute to the development of arthritis are sugar, saturated fat, trans fat, omega-6 fatty acids, monosodium glutamate, gluten, casein, and aspartame. 4. Gluten. As we already told you that gluten may promote arthritis, you must wonder how. Intolerance to gluten is known as celiac disease. It is an autoimmune disorder where the immune system mistakenly attacks healthy tissue. In people suffering from it, gluten, found in grains like wheat, barley, and rye, triggers an autoimmune response that damages the small intestine and affects nutrient absorption. This leads to gastrointestinal symptoms and systemic problems, including joint pain and inflammation. Additionally, gluten is a complex protein that isn't completely digested by some individuals. The immune system may perceive undigested gluten as a threat, unleashing an attack that causes inflammation not only in the intestines but also in other organs and tissues, including the joints. Furthermore, it appears that gluten is a glycoprotein that has an effect that is clinically relevant in terms of inflammation. A correlation between gluten and a variety of diseases, including autoimmune diseases like rheumatoid arthritis, has been reported in a number of observational studies and anecdotal cases. According to the recommendation of specialists, a diet that does not contain gluten may be an effective method for managing inflammation and the ongoing symptoms of rheumatoid arthritis. 5. Alcohol. If you are a heavy drinker or occasionally drink, you must learn about its impact on your health. Although alcohol may not be directly pushing you towards arthritis, it may still become dangerous. For those already suffering from the disease, alcohol may interact negatively with various medications. Non-steroidal anti-inflammatory drugs such as acetaminophen, methotrexate, and leflunomide are examples of medications that may have adverse interactions with alcohol, leading to increased risks of stomach bleeding, ulcers, and liver damage. For individuals with gout, a form of arthritis, alcohol may be particularly harmful. Alcoholic beverages, especially beer, which is high in purines, may trigger gout attacks. Purines are substances that, when metabolized, lead to the production of uric acid, an excess of which causes gout. Distilled liquor, and, to a lesser extent, wine may also exacerbate gout symptoms. There have been numerous studies on this subject. One study involving about 100 patients with osteoarthritis, 95 with rheumatoid arthritis, and 90 non-arthritic controls examined the relationship between alcohol consumption and arthritis. It was found that osteoarthritic men were more likely to have been heavy drinkers, while men suffering from rheumatoid arthritis were less likely. Interestingly, the later group reported an increase in joint pain after drinking alcohol, leading to abstention due to the fear of adverse drug reactions and a belief that alcohol and arthritis do not mix. 6. Dairy products. The link between dairy products and arthritis is complex and depends on various factors, including the type of dairy product, the individual's health status, and their specific sensitivities. While certain dairy products, like yogurt, may offer anti-inflammatory benefits, others high in saturated fats might contribute to inflammation. If you are a fan of dairy products, you must know that they contain a high level of casein protein. This type of protein triggers inflammation and pain in the joints and may even contribute to irritation around the joints. Some dairy products, such as butter, contain a high amount of saturated fat. This may also contribute to inflammation and joint pain, so it should be avoided at all costs. But you should also remember that different types of milk play a vital role. For example, there had been a study to explore the association between dairy consumption and the presence of knee osteoarthritis in about 3,000 individuals aged 40 to 75 years in the Dutch population. According to the findings, a higher intake of full-fat dairy and Dutch cheese, but not milk, was cross-sectionally associated with a lower presence of knee osteoarthritis. 7. Salt and preservatives. Salt, while a vital nutrient, may have detrimental effects when consumed in excess. It has been implicated in triggering or worsening certain autoimmune diseases, which may include inflammatory arthritis. In a hypertonic saline environment, immune cells such as macrophages release more pro-inflammatory cytokines, produce reactive oxygen species, and activate the inflammasome. T helper cells differentiate between Th17 cells under these conditions, which are known to worsen conditions like multiple sclerosis and rheumatoid arthritis. Moreover, excessive salt intake is associated with a higher risk of developing autoimmune arthritis, particularly in smokers. Foods that are heavily processed and contain chemical preservatives and unnatural ingredients are considered inflammatory. Many meat products, which are common in diets, contain preservatives, artificial ingredients, and hormones, which may cause systemic inflammatory reactions, especially in people with rheumatoid arthritis. Apart from that, processed meats modified with hydrogenated oils and saturated or trans fats are particularly problematic. Monosodium glutamate, or MSG, a common flavor enhancer and preservative in processed foods, is also a concern, although its direct link to inflammation is not clear. These chemical-based foods may cause the body to react negatively, leading to inflammatory symptoms. In a study with about 19,000 participants, an average age of 38 and 60% women, there were about 390 rheumatoid arthritis patients with a median sodium intake of about 3 grams. A significant link was found between high sodium intake and rheumatoid arthritis. Individuals in the highest quartile of sodium intake had a 1.5 times higher chance of rheumatoid arthritis. 8. Corn oil. If you wonder why vegetable oil is on this list, let us explain a bit. Corn oil is rich in omega-6 fatty acids and is particularly known for promoting the creation of eicosanoids. These are signaling molecules that may lead to systemic inflammation. chronic inflammation, as seen in arthritis, may be exacerbated by a diet high in omega-6 fatty acids due to the increased production of these inflammatory molecules. Apart from its impact on inflammation, corn oil has been linked to potential toxicity, an increased risk of cancer, cardiovascular disease, stomach irritation, and weight gain. These factors may further complicate the health status of individuals with arthritis. What's more, corn oil is about 30 to 60% linoleic acid, a type of polyunsaturated omega-6 fat. Polyunsaturated fats include omega-6 and omega-3 fats. The latter are associated with decreased inflammation and better health when they're present in the body at a ratio of about 4:1 of omega-6 to omega-3. Corn oil has an omega-6 to omega-3 ratio of 46:1, which may contribute to this imbalance. That's why you should be careful about having corn oil in your diet. 9. Omega-6 fatty acids. Earlier, you heard that foods filled with omega-6 fatty acids are not suitable for people with arthritis. While omega-6 fatty acids are essential for health, their excessive consumption may potentially worsen the symptoms due to their pro-inflammatory properties. There are several pieces of evidence that prove a connection between higher dietary intake of omega-6 fats and inflammation leading to tissue damage and disease, which could be pertinent of conditions like arthritis. Human studies done recently show that the ratio of omega-6 to omega-3 fatty acids, along with the total amounts of these acids eaten, is a key factor in making people fat. This is because it affects both eicosanoid metabolites and the overactivity of the cannabinoid system. Gaining weight puts pressure on the knees, further exacerbating the inflammation and increasing the pain. Then what is the correct amount of omega-6 fatty acids that will provide health benefits without enhancing inflammation and arthritis? Well, experts suggest that men should consume 17 grams per day, while 12 grams per day for females will be good enough. How may you prevent arthritis? Preventing arthritis involves a multifaceted approach focusing on maintaining overall joint health and reducing risk factors. In the next part of this video, we have mentioned a few key strategies to help prevent arthritis. 1. Maintain a healthy weight. Excess weight puts additional stress on your joints, especially your knees, hips, and spine. Keeping a healthy weight reduces this stress and lowers the risk of developing osteoarthritis. 2. Stay active. Regular exercise strengthens the muscles around your joints, which helps keep them stable and reduces wear and tear. Low-impact activities like swimming, walking, and cycling are beneficial. 3. Eat a balanced diet. A diet rich in antioxidants, found in fruits and vegetables, may help reduce inflammation. Foods high in omega-3 fatty acids, like fish, may also help manage inflammation. 4. Avoid joint injuries. Protect your joints from injuries, as they may increase the risk of arthritis. Use protective gear while playing sports and learn the correct way to exercise and lift heavy objects. 5. Quit smoking. Smoking increases the risk of rheumatoid arthritis and may worsen the disease's severity. Quitting smoking may significantly reduce these risks. 6. Stay hydrated. Adequate hydration is essential for maintaining the health of your joint cartilage. 7. Mind your posture. Good posture protects your joints from unnecessary stress, especially in your neck, back, hips, and knees. 8. Manage blood sugar levels. High blood sugar may damage your joints. Keeping your blood sugar levels in check may help prevent arthritis. Managing arthritis involves more than just medication and exercise. Diet plays a pivotal role. By avoiding these 9 foods, you may better manage arthritis symptoms and lead a healthier life. Remember, individual responses vary, so it's important to listen to your body and consult with healthcare professionals for personalized advice. Making dietary adjustments may be a powerful tool in your arsenal against arthritis, paving the way for reduced pain and increased mobility. Today, we learned about all the foods that may worsen arthritis. But did you know that there are many useful things in your pantry that may be just as helpful? Want to find out more? Watch 12 powerful health benefits of apple cider vinegar you never knew about. Or watch use baking soda on your body every day for 1 month. See what happens. You may watch either or both of them. What food from this video do you consume most? Let us know in the comments section below.